And we are live. Wow, so good to be here. Honestly, like I was just thinking about everything and I was like, man, I can't wait to sit and hear you talk about this topic.
I couldn't wait to. I mean, this is like my first YouTube live, and then YouTube brought out this YouTube collaboration, so it was amazing to me. I was before you asked me, I was like, okay,
Honestly.
this is so great, like
Wow.
YouTube live, like this is a good thing, right? But then I wasn't big on YouTube. I still am not big. I mean, I just have 8 subscribers. I'm grateful for them, but then I was like, okay, when I do eventually want to, I mean, the ground is already set, the tone is already set that as we as creators, we have an opportunity to grow, right? And collaboration is something that I've seen that platforms like Instagram love it a lot and for good reason. So um seeing that YouTube jumped on the wagon and was able to put it such that you could actually collaborate with other channels. The only thing I don't like about collaboration on YouTube is that it has to be on the phone or tablet. Right now I'm using my tab because I just feel like it's
Okay.
going to give me better control, but essentially, aside that, I think that YouTube collaboration feature is a fantastic idea.
True. Very true. I can't agree less, honestly.
Yeah.
It's so nice. True. All right. So I trust you're doing well, right? I can see all over your face, like you're glowing, taking
No,
all the
trust me.
vitamins to yourself with you.
Oh my god, no, I mean, I'm not going that much. It's just maybe it's a filter. I don't know. I mean, maybe I press something and then who knows?
All right. So I just want you to tell us quickly, like, who is Farm Margaret? Because I know a lot of people don't know that there is a resource person who is so much passionate about vitamins and seeing women take their supplements and their vitamins very often. So I want you to tell us, for most of us that are just coming in, wow, we have two persons who have already joined us live. Welcome.
Woohoo!
Thank you guys. Thank you guys for joining. Please bring out your reaction so that we know that you are active with us. Show us those
Yes.
reactions. Cool. And I know many other ladies are going to join in, definitely. Some are trying to settle up themselves and all of that. Wow. You can also type in the comment section where you are joining us from so that people who are coming in, we know that there is
Yes.
something happening
Yes, please. Yes, please. Yes, please. Join us,
here.
please. Thank you so much. So yeah,
Wow. We have
say
19 people
hi,
alive
brother.
already. 19. Amazing.
Wow.
Okay, so from Margaret, quickly, can you just tell us who are you? For most people who don't know, I know you are passionate about vitamins and what women take. But let us
Yeah.
know again. Can you kindly introduce yourself to us? Who are you?
Okay, so this is a great opportunity. Once again, hi everyone. Thank you so much for being here. It means a lot to me.
Thank
I
you.
haven't been on a YouTube live, I think just once ever, and it wasn't something that had to do with health. So this is like something major for me, and I really appreciate it. So essentially, I am from Margaret, pharmacist. I recently even became a pharmacist, but I already started branding as a pharmacist because that's what I am, right? So um, for
Uh,
the past 5 years, I've been in the content marketing industry, particularly in health. So I have worked with a couple of brands as a journalist, a writer, a blogger, a content marketer, and you name it. I've worked in different kinds of sectors, not just content writing, which is a branch under content marketing. Also find myself in video. I find myself in emails, AI, automations, whatnot. Just essentially everything that helps brands to move forward to the next step. And then, being in the health space, being passionate about the health industry, it means a lot to me. It's easier for me to relate because that's what I entered into. And then I and Healthy Tuesday are here today because I built and I'm currently still building my health blog. Let me see if I can put it up here. So my health blog essentially is about women supplement vitamins for women, and it's a place where you can get the latest information about vitamin supplements that you should be taking, which is essentially what we're talking about today. So this
yeah.
is my health blog. You can see I have over 400 blog posts on this place, and it's barely 2 years. I think it's a year plus. It will be two in like March. And we have a couple of blog posts that you can read here. There's so much information. You can also join our email list. It pops up immediately you go to the website. So my blog is like where I share what I know about supplements. And essentially, why I started Vitamins for Women was because when I was doing my sideways internship placement rotation in when I was in my third year, I got came across women who were struggling to get the right information about supplements. They were kind of confused, and I saw that there was a gap. There was a need to say these kind of things to them, to give them information, not just in the local community, but beyond, because it was something I started noticing that a lot of women needed information, they needed more knowledge about that. So um, that's the reason why I brought about Vitamins for Women, and today we're at 12,000 sessions, like, you know, 100,000. Like, I mean, if I pull up our Google Analytics, I will be able to see how many active users we have. But it's so much that I cannot believe it, and this is just done in such a short time. So I mean, it's so amazing. We have like about almost 10,000 active users on our blog post. So
Wow.
for something that is barely anywhere, pulling up those kind of numbers, it shows that not only do I know how to um, push a brand, but I also know how to educate people in something that they'll be interested in reading or learning or knowing about. So yeah, that's like the summary a bit of who I am and what Farm Margaret is here to show you today. Thank you.
Wow. And this is why I am so excited, because this topic is something that every lady needs to pay attention to. And like the story you shared when you were doing your internship, I think it's very relatable. Very, very relatable. So quickly, while we go into this section, I just want you to tell us what are the necessary vitamins women need in their everyday life. We want to know this. We want every woman out there to know this. So share with us, what are the necessary vitamins every woman needs for their everyday life?
Okay, so I wouldn't say one size fits all in when it comes to vitamins. I mean, there are everyone has their own take and what would be more important to them. But I would say some vitamins and the cases where you would look out for these things, where maybe you have some sort of condition or something that you're trying to improve in your body, what vitamin should you be looking at, that kind of thing. So the first one is vitamin D, and we all know that vitamin D is for strong bones. It also helps with your immunity and it helps with mood support. Right? So if you feel like you're always getting cranky, maybe towards your periods and all of that stuff, you might actually consider taking vitamin D. And then another one is calcium. Calcium also helps to maintain strong bones and it prevents osteoporosis, right? So that's another one that you should be looking out for. Now we have iron.
Calcium.
Yes, calcium. Then we have iron. Iron is to replace what is lost during menstruation. I don't know if some women here experience it, but I, for one, experience it that after my monthly flow, I see that I am a bit dizzy and it's not the same for me. So it's important for you to understand that taking iron or taking supplements in general will help you to replenish with your body with what it needs, because it's not like as if you are excessively taking out so much blood during your monthly flow, but that little you take out, remember that we as women, we don't even have as much as our male counterparts. So
Not at all.
it's better for you to understand this and take the supplements that will help you to be okay, right? So iron is, and when I talk about supplements, I always like to put it out there that some people do not like to swallow pills. So when I give you these vitamins, look for it in your meals, because your food contain that's the first introduction you have to food. Now there are some vitamins, some supplements that are not soluble, that you cannot get from food, which is why it's encapsulated. So that's when you go to start looking for how to buy them. But if you know that you're not someone who is so heavy on what you're taking, then I would advise that you buy supplements as well. So after iron, we have B9, that's folate, and then especially important for women of childbearing age. Especially for it's great for healthy DNA and pregnancy outcomes. If you're trying to get pregnant, you should be stocking up on vitamin B9. Now we also have vitamin B12, which is great for nerve health and energy. And we have the omega 3s, omega 3 fatty acids. They are not vitamins, but they are worth mentioning for their heart, brain, and joint health. So these supplements are supplements that you should be including in your routine. Now, I want to mention something that Just because I mentioned here 6 supplements does not mean that you should go and buy 6 capsules, 6 bottles,
Exactly.
right? You
Okay.
can look for a supplement, like I would give out one for free here, Darabites Woman. Yeah, they have a combination of these supplements and even more, particularly for women. You can take that and it will help you to see that all these things I've mentioned are inside these supplements. The importance of you educating yourself with the right supplements that you should be taking is so that when you go to your hospital, or rather your local pharmacy the next time, that you look out for these things in the supplements you're trying to buy. That way, no one tries to sell to you a product that you do not need.
Mm-hmm.
Every single person has a certain kind of body. We do not share the same body. What might be work for you might not work for another person, which is why in my articles I always tell people make sure that you consult a doctor. Not because I want to send you to a doctor or to long queues, but because sometimes you might have something that's peculiar to you, that these supplements are going to disrupt. There might be some interaction between the medications you're taking and these supplements. So just because you see a symptom or have a symptom does not mean that you run to supplement next. You should have a go ahead, and then when you have a go ahead from your doctor that yes, you should stock up on this, you go to the pharmacy and you're looking for something specific. Having information, if you know your health profile and you're like, okay, everything about me, I know my health status and all of that, then you can be able to make decisions on your own. So I think that is what I have to say regarding the necessary vitamins women should include in their routine.
Okay, and I think this is very important. Like saying this, most women, like using myself for instance, especially when you talked about after our monthly period, this we just feel this drop in our energy, and like you said, that's iron actually is something that leaves
Mm-hmm.
our monthly period very much because of the blood leaving. So most times we women just ignore this iron part. And I think hearing this now is like an encouragement to keep taking the iron vitamins
Mm-hmm.
so well.
Yeah.
Right. So running through, we just want to know since we found out that vitamins are necessary for women, we just want to know what are the vitamins that are restricted for different stages of our life. Because I know sometimes when a medical doctor will tell you if you are pregnant, take this. If you are trying to conceive, for those TTC women, take this particular vitamin. Then it's kind of making me wonder, are there specific vitamins for different stages of our life? Or as women, we just head on to taking any vitamin we see? Please let us know.
Okay. Okay, so I already said something when I was talking for the last question. I was saying that vitamin B9 is great for people who are trying to get pregnant, right? Great for healthy DNA and also for pregnancy, people within the childbearing age. Now, speaking of childbearing years, if I mean, I already mentioned vitamin B9. Iron needs to rise due to monthly blood loss and pregnancy demands. So we also need vitamin B12. It supports energy and mood. Remember that you're going to be a bit cranky during that period. If not from your period, then from pregnancy itself. So vitamin B12 is amazing. Omega 3s are great for heart and brain health, both for you and your child that is developing. So you need to consider these and make sure that your supplement that you're taking, pregnancy supplements that you're taking or trying to conceive, has the right amount. You do not want to buy a supplement that does not have the right amount of supplement.
Oh,
Just because a
oh,
supplement has all the vitamins inside it does not mean it has the amount of milligram. So we're not just talking about
mm,
content, we're talking about milligram. So these are things that we
milligram.
need to understand, right? So
Mm,
for teens and early 20s, your body is still developing, menstrual cycle begins, so we can just tell them to take iron, vegetables, because at that time you may not necessarily want to expose yourself to medications. So it's great to get these vitamins in what you are eating, right? And then, you look at calcium with vitamin D is great for bone mass, to improve bone mass, building bone mass. Folate is as well great if you're trying to get pregnant, like I already said. Then, if we're looking at people that are perimenopause, menopause, 40s, 50s, that transition, your hormones start to
yeah.
fluctuate. So, there you're looking also at calcium and vitamin D because bone mass, right?
Okay.
We're also looking to improve bone mass. B vitamins like B6 and B12, they help with energy and brain support. Then we're also looking at vitamin E and magnesium, which may help to ease those menopausal symptoms, brain fog, hot flashes. I talk about menopause supplements in like explicitly on my blog. So you can actually check it vitaminsforwoman.com and you will get a lot of information. If you know you want to even have more insider information, when you get to my blog, please subscribe to the email list because I would be able to tell you more things even outside the blog. Now, we also have vitamin E and magnesium. It may help to ease menopausal support symptoms, like I said, hot flashes, and sleep problems, because people that have menopause have noticed that they have some sort of insomnia. So, if you know you want to deal with that, taking vitamin E, magnesium. Magnesium is a something I literally just spoke about magnesium for sleep, what it does, how it works, why you should take it, and even supplements to consider. You can check it out. It's a recent blog post on the website as we speak. Now, another thing I'm talking about is people that are 60s and beyond. These kind of people, their absorption of certain vitamins decreases with age. And so vitamin D is even more important because you see that they are they have a higher tendency to fall. So you want to give them vitamin D so that they have stronger bones, they have more energy to support themselves. Vitamin B deficiency is quite common, so supplementation is great. Then antioxidants like vitamin C and vitamin E helps protect the eyes and skin. As you are aging, you are having certain drawbacks, things that might just be at optimal level might start to drop. So taking supplements is even greater. Omega 3s as well can support their heart and brain longevity to prevent things like dementia and whatnot. So yeah, that is
Okay.
what I think for supplements at different stages of life.
Amazing. And before we continue, I just want to mention the people I'm seeing. Thank you, Ijoma, for joining us. Thank you, Grace Wilson. I can see your reactions. Thank you, Mr. Bendra. Thank you. Welcome to Africa. Thank you, up to Craft with Canva. Okay, thank you so much for joining in. And we
Thank you
also see
guys.
Miss P's Good Speed. Thank you guys. This is so beautiful. You guys are amazing. And for those who are still coming in, thank you all. Thank you all. We are talking about vitamins and the essential vitamins we need. Because trust me, the more we age in life, the more we discover that, like she said, there are things that we need to keep us in living healthy because we can't do without it. And if you watch some of the things she has mentioned, she talked about iron. I am still pondering on this iron aspect because I know what it feels like to lose blood every month. And most ladies, I think, don't even know this. But like she said, when you take in iron supplements, it helps renew those blood you have lost in the previous month of your menstrual bleeding. So I think this is a great eye opener, and I'm so happy to have Margaret here because she's encouraging every one of us to know what is necessary. You don't need to fold your hands and feel it's not necessary. It is necessary. She also mentioned magnesium. I think so. She mentioned magnesium for sleep. I know there was a story of one of my queens in our community. She mentioned that there was a time she was not sleeping properly. She was having insomnia, and I think if we understand how our body functions, we should know that if this insomnia is coming in, then magnesium is lacking. This is relatable, right, for Margaret?
Yes, absolutely.
Okay.
That's
So
exactly
you
what I was
see,
saying.
magnesium, like she mentioned, is there. We also have omega 3. She talked about it helping our heart rate. She talked about it being so important no matter your age. Like this omega 3, like she said, it's quite important. So if you are joining in, trust me, you are at the right spot. You are at the right spot. So in order for us to move on in this section, I discovered some things. So, for Margaret, you help me clear my doubts. When I went to the pharmacy to purchase a particular supplement, I was like, is there a difference between supplements and vitamins? Because I saw some of them, they wrote supplements on it, and some of them, they wrote vitamins. And I was wondering, is there any difference? What's the difference between the vitamins and supplements? Please, you need to let us understand if there is a difference in it.
Okay, great question, because sometimes I also mix them up as well. But you see, vitamins are specific organic nutrients, right? We have vitamin A, we have vitamin C, we have vitamin D, E, K. But then supplements, on the other hand, is a broader term. It includes vitamins, but it also includes minerals. So you have things like probiotics, those are minerals. You have protein powders, omega 3s, herbal products, right? So you have no, protein powders are protein powders and probiotics are not minerals, but these are things that include supplements. So every vitamin is a supplement, but it's not all supplements that are vitamins,
Mm, mm.
because supplements include more than just vitamins. We have probiotics, we have protein powders, we have omega-3 capsules, we even have herbal products. These are all supplements. They're trying to supplement something that is missing in your routine, in your diet, right? And one of those things include vitamins.
Mm.
Yes. So a supplement is a congregation. That's why you see Diavite supplement contains vitamins and some minerals. But you could buy these vitamins separately if you are excessively lacking a particular vitamin. And you can only know that when you take a test. That's what tests will show. Are you beyond or below the level? Right? So that's what vitamins do. There was a time I was
So
having
that
an
means
inner
we
scar.
shouldn't just go ahead to purchase. We shouldn't just go ahead to purchase a particular vitamin. We should ensure that a test is being done.
Yes.
Is
And
that what
or
you're trying?
yes, or at least you are being told to. I was trying to say that there was a time I noticed that I had a certain um, ulceration in the inner side of my cheek, and that was because I was deficient of vitamin C. I think that I was eating poorly at that time because of stress levels and whatnot. So the moment I started to take 1,000 milligram of vitamin C daily, that scar disappeared. So this is because of the information that I have, but someone might not know this. So instead of popping different pills into your body, you can just go for a test to know that okay, I am deficient in a certain amount of vitamin and I need to supplement. That's just it.
I can't agree less. Honestly, I can't really agree less because I know early last year, last 2 years, and even up to this moment, there's this movement of supplements. You know, if you don't take, you go on TikTok. If you don't take supplement, it look as if you are not living. But then I was always certain that you see some person that will take, they have vitamin E. For instance, this is vitamin E. They have vitamin E in their house, and then they are also taking they're also taking like a supplement that has vitamin E inside of it, and they have vitamin C as well. Like they bought vitamin C as well, and they have a supplement that has vitamin C as well. But then I was beginning to be troubled because I felt, this not overdose? Taking the supplement at one hand and also taking vitamin E, vitamin C, and this same thing is already inside the supplement you are taking. Like, let us know, is this not like toxic? You have a supplement and you're also taking
It
vitamin E,
depends. It
vitamin C.
depends. I would say that it
Hmm.
depends. And the reason why I say that is because there are some people that they are the dosage that they are getting from the single vitamin, or rather the dosage that they are getting from the supplements combination or combined is not enough. So their pharmacist
Okay.
or their health physician, the doctor, can tell them,
Okay.
okay, you are taking, maybe you are only getting like 50 or 20 milligrams of vitamin E in this combination supplement. So you should buy
Hmm.
vitamin E separately so that you can have the right milligram being delivered to your body, depending on what you need. So in that case, it's not overdose. But if you do not know whether, most of these vitamins, they have ranges. Like the range you're supposed to take certain medication. So if you're passing the range, that's where there's a problem. Or if you're taking what you don't really need, that's where there's a problem. But outside any of this, if it is recommended by a doctor, sometimes these supplements like I said, supplements contains more than vitamins. So if you are taking a supplement that contains more than vitamins, and outside the vitamin, there are some other things that your body needs. So you are taking that supplement because of those other things, but the main vitamin that is there that you need a lot of, the supplement doesn't have that amount. You need to buy another vitamin specifically for that one. So it's not overdose. So you see, some people are taking it because they were asked to. But there are some people who they do not even know what they're taking, and that's where I frown at it because it's not right.
Okay.
So yeah.
Hmm. All right. Can you hear me clearly?
Yes, I can.
All right. So before we move on, I still want to recommend that I'm seeing the friends of Ayo Midday Pressures. Thank you all for joining in. Thank you, Ayomide. Thank you, Precious. And it has been a very, very beautiful start. Even up to this moment, like I am amazed because you hit on the point that there was a time you went for a test, and in that test, you discovered that you need to start taking vitamin C. But before then, you discovered that there was a way you were actually, like you said you discovered there was something you were feeling, and that was what made you to go for the test. So, in that manner, can you let us know what are some of the symptoms we can watch out for before we then say, okay, I am lacking in this vitamin? Because trust me, many of us wouldn't know, or we kind of ignore those symptoms, thinking they are just normal. So let us know.
Okay, so well, for me, the thing is, when it came to vitamin C normally comes with, sorghum, or you have some whitish, something, it's white, on skin, inner skin, right? So that's vitamin C problem. And so that was what really made me to go and consult a pharmacist. And
Look
that
at
was
my,
what I was
I have to
given
look at
that.
my skin.
No, no, no. I mean inside, like inside your skin, like mucous membranes, right? So like things like scurvy, that's what
Wow.
vitamin C comes as. So not your body. So then, what things like for iron deficiency, you start feeling dizzy. It normally comes with heavy periods, and so things like
Mm,
vitamin D,
wow.
you can find out that maybe you are
Wow.
getting too cold, you are frequently cold, or you have a
Wow.
weakened immunity. Then for hair
Mm-hmm.
loss, maybe if you're losing your hair, it could be that you're lacking B7, which is why biotin
You
is
mean hair
fantastic.
loss?
Yes, vitamin B7 is great for people that want to grow their hair. But the thing is, hair growth is very relative in
So
the
I can
sense
literally
that,
take vitamin B7 if I want to improve my hair texture.
yes, yes, you can. And
Wow.
the thing about
Wow.
vitamin B7 is that it actually does work. It's just that the results might differ depending on how your family history, DNA,
Regen-
and genetics. Yeah, but then it works for hair. Even zinc as well also helps with hair, especially brittle nails. Zinc is fantastic for nail health, nail growth. If you notice that you have a
Our
lot of brittle
nails,
nails,
our
yes,
fingernails.
yes, zinc.
Wow.
So, when it comes to mood, anxiety, low mood, things that could signal, signal those things, lack of vitamin D. We also have B. I remember mentioning B6, B12. These ones help with energy. Now, if you are having bone or joint pain, it could be that you're lacking vitamin D or calcium. And then, you see, I want to stop and say something. People who are lactose intolerant, or people that feel like maybe you've always had a problem with milk from childbirth, please do not joke with other forms of getting calcium. Because the thing is, when you shorten your rations on calcium and vitamin D intake, you end up suffering for it when you are older with things like osteoporosis, that is very common in women, and some joint related deficiencies and disorders. So try your best to look for ways to take calcium without taking milk, cow milk, that may be disturbing you. So that is one thing I want to say regarding vitamin D and calcium. Then I also mentioned, for things like poor night vision or dry eyes, is vitamin A. And then, if you have slow wound healing, vitamin C could be the issue as well. And then, if you have low vitamin E or vitamin C, then it could be that you have a fragile skin. If you have fragile skin, rather, it could be that you have a low level of vitamin E or vitamin C, which
Vitamin
all
C.
help with collagen
Okay.
production. They're antioxidants and they
Oh,
help with collagen production. So that is what I have to say regarding those ones.
oh. Now this is even getting more interesting because I know of someone who has like any little thing, the skin just there's a scar. Any little thing, like there's just injury on the skin. And you mentioned one thing about collagen and vitamin E. Like, let us know because is it that the body doesn't produce these vitamins and then this person needs to take it? Because for me now it's different. My own skin is very much different. But for this person, you can just like literally pinch the person and the skin is the skin is just going just going off. And I'm kind of getting to be interested more with what you just said right now. So let us know about this collagen and the issue of being our skin.
Okay, so the thing is, your body doesn't produce vitamin C or E at all, and vitamin C and E are helpful in the production of collagen. So, if your body doesn't produce, your body produces just a little amount of vitamin D, and it's made in the skin when sunlight hits it. You see, but many women don't make enough, especially if they live indoors, cover their skin, or they have darker skin, right? So,
Yeah.
things like vitamin C, vitamin E, vitamin A, vitamin B complex, they are not made by your body, and your body needs them. So if you're not taking them, you're going to start having issues. Remember that we said that vitamin E and vitamin C, low levels of both of them, would lead to having thin, fragile skin. So that person might be lacking vitamin E or vitamin C and they're not aware. Yeah.
Like ladies, I hope you are actually learning a lot because I'm really this is like I said before, this is an eye opener. So for everyone who is joining, honestly, like this has been a great time, and we're not even done with all she has for us. But trust me, this has actually been like a great eye opener. Yes, Ayomide says she has been struggling with hair. You see. So she mentioned about vitamin B. You said
Seven.
B what?
B7. B7.
B7. So you
Yeah,
see,
biotin.
now you know. No, yeah. So now Ayomide, I think you need to increase, like like she said, you need to see this and go ahead and know that, man, I need to top on my vitamin B7 because you don't need to wait for your hair to go all bad before you know that this is very important. Thank you for joining in, Ududu. Thank you so much, Ududu, for joining in. We see your reactions. And just to clear us who are joining in, Farm Margaret is a specialist in vitamins. She has been working with women and she has been delivering so much for them. Like, if you need to know about vitamins, then this event is really the game you need for it. Invite your friends, those who are not here, tell them to join this live right away. Because she mentioned something, you said that if we ignore a particular vitamin, then in our when we go old, we are going to suffer for it. I think you mentioned about calcium and
Vitamin D.
lactose intolerance.
Yeah.
Vitamin D, yeah, saying those who are lactose intolerant, if they don't have enough vitamin D and if they don't have enough calcium, they are going to suffer for it when they are old. I hear of a lot of women saying back pain. Is this actually connected?
Yeah, and I have a fantastic case study. My mom, she didn't really take a lot of milk when she was growing old, and now she's having some certain joint issues. So that's the reason why it came to mind for me to say it here because it hits home for me. I know that I also didn't really tolerate a lot of milk when I was growing up. But knowing what I know now, I understand that it's not an excuse for you to not have supplements. That's why they are made in the first place. There are some people who might not be who might be allergic to certain things that will give them the right amount of vitamins, but taking supplements, it's just the way to bypass all those things and just give your body what it needs, like hitting the nail on the head. That's it.
Wow. All right. This is getting more interesting. This is even getting more interesting. So you are speaking from your experience, from the encounters you've had, and I think this is why I see a lot of passion when you talk about this. Now,
Yeah.
tell me, if you were to give an advice to your younger self, what vitamin would that be? Like, if you were to give an advice to your younger self to start taking a particular vitamin, what vitamin would that have been?
For me, like I said, I had issues with milk when I was growing up. So I would have taken, or I would take, or look for ways that I can take not cow based, maybe plant based milk, or different ways. So it would be calcium for me, vitamin D for me. Yeah, I also feel like, yeah, I think yeah, that's just basically what it would be for me, right? And then if I was having any hormonal issues, I'll just add evening primrose oil. It's a supplement that helps you to balance your hormones due to the production of lanolenic, the content of lanolenic acid in evening primrose oil. That also helps. So, yeah, I essentially believe that it's always different for everybody. Like what I would say that I would take is different from what another person would take. Like if I took calcium and vitamin D because of milk issues, I would take food that contain iron, like vegetables. I know my body really loves vegetables, so I'll take vegetables to be able to have a right amount of iron in my body. But when it comes to supplements, I would put in vitamin D, calcium, especially. Yeah, thank you.
Amazing. So this is where I am even beginning to ask myself question, because I know, like, I want to have a child. I definitely want to have my baby. But then there was this post I saw on Instagram. The lady was lamenting. She was like, if she had known there were certain vitamins she would have taken before she even got married, and many other people were commenting that because they didn't take a particular supplement or a particular vitamins, the child they gave birth to was actually had some issues. Some of them had displacement of their facial, like if you see the child is looking somehow, which nobody prays for that. But then when they went back to the medical doctor, they were like, you didn't take a particular vitamin. You didn't take a particular vitamin. And honestly, knowing that, I know there are a lot of women who are here who want to have their own child, they want to hold their children. Can you let us know, are there vitamins we need to start taking now, or we need to wait till we get pregnant first before we take these particular vitamins? Because I don't think any woman here, any queen here wants to have that kind of story.
Yes, I agree. The thing is, essential vitamins that you can take before pregnancy. I already talked about vitamin B9, which is folate. You can also stock up on iron. You see, the reason why I'm telling you to take folate or vitamin B9 is because vitamin B9 prevents neural tube defects in your baby's brain and spine. So you want to ensure that you are taking the right amount of vitamin B9, right? To say like 400 to 800 microgram daily. And that's of course 1 to 3 months before pregnancy, before conception, before you even think about it. Then you need vitamin D, which supports bone health, immune function, and hormone regulation. Another
Okay.
thing is vitamin D is helped to, I mean, deficiency in vitamin D, some report says that it's how it's responsible for complications in gestational diabetes or preeclampsia, which is pregnancy induced hypertension. Then we also have vitamin B12. Vitamin B12 works hand in hand with folate to support DNA formation and red blood cell health. So you want to make sure that you take it, especially for people that are vegetarians and vegans who do not have enough of that in animal food. You should be able to take supplements, right? Now, omega 3s, DHA, EPA, they're not vitamins, like I said, but they're very important, and they support brain and eye development of the baby and improves maternal mood. Your mood is very important. Then iodine is needed for thyroid health and baby's brain development, and many prenatal vitamins include it, but it's worth checking to make sure that you have iodine in the supplements that you are buying.
Now tell us, because seeing all the supplements you mentioned and all of these vitamins you mentioned, trust me, I for one, I don't like pills. I don't like pills at all. I know there's a particular vitamin I take, but I am thinking that there is a lot I still need to take. After hearing all you've been saying, I feel I haven't taken this. I haven't taken this. I haven't taken vitamin B7. And with what you said so far about vitamin B7, I feel I need to take it. But now I want you to tell us, because how do we get it? Like, how do we get it? How do we get these vitamins? Fine. I know there are people who are not scared of taking pills. They are not scared at all. They could actually pop in 20 pills at a go. So please tell us, how else can we get it? Is
Well,
there other
there are
method we
different,
can
yeah,
get
there are
it?
different dosage forms of vitamins. Not everything is a pill or a capsule. Some of them, there are ones that are hard. Those are the ones that are tablets. We have capsules. They are easier to swallow. Then we have gummies. There are also liquid vitamins, right? Now, gummies are great because they are sweetened and you can chew them. So it's like taking soft sweets and you're taking your vitamins, right? So that is also a way. And now I already mentioned in the beginning of this live that it's not everyone that must take vitamins supplements with in form of drugs. You can take them in
Okay.
food. So it's just a matter of you knowing the vitamins that you need and finding out the foods that are containing them in your locality, depending on where you are based, and taking those foods. As long as you take those foods, you also have those vitamins in your system. Yes.
Now, now you mentioned food, I'm actually even more happier. So tell us, what food, how can we get this vitamin? What food would you actually advise us to go on? Because I think some persons will be like, I don't have the money, I can't afford all of these supplements. So let us get some of the list of these foods we can get, and how much of them do we need to consume? How much of them do we need to consume? Because I don't want it to be that after the end of this section, people just go ahead to the pharmacy and purchase and purchase and purchase without, like you said, not every one of us need certain vitamins. So what food can we get them from, and how much of these vitamins do we need so that we don't end up in danger?
Okay, so the thing is, it's not really going to be reasonable saying the amount because, like, if like for something like folate, I can't tell you take two pieces of greens or two leaves, right? It contains vitamin B9. So it would be reasonable for you to knowing that, okay, I need folate. I am trying to, there was when my mom was, I'm the first child, and when my mom was pregnant with me, she went to the hospital for her antenatal, and they told her that she needed to stock up on iron, folate, because she didn't have enough before delivering me. And when she came home, she squeezed greens and took the juice of it, and by the time it was time for her to give birth to me, she was able to. So she didn't have to take any supplements. She just took food. Now she took an amount, that huge amount, because she was pregnant for me. Someone that is um not necessarily deficient but just wants to be on the safe side can just include it in their soups. Spinach, kale, ugu, all your dark leafy greens around you, um, legumes like beans. Then we also have citrus fruits like oranges, grapefruits, avocados. These are they contain vitamin B9. For iron, that's your meat. Now, if you know that you are a vegetarian, you do not take meat, fish food, poultry, seafood, that's when you have to take vitamins because you have to pick a side, right? Then there are some,
Mm.
but the thing is that there are also plant sources that contain iron, like beans, so you can get it from there. Pumpkin seeds, spinach, right? Now, the thing is, when you are taking plant-based meals that contain iron, you should pair it with vitamin C foods like oranges or tomatoes to boost absorption. Because some foods are not easily absorbed, they need another helping hand like this iron. Then for vitamin D, we have fish, fatty fish, egg yolks. People that tell you that egg yolks are not good for you, it's not necessarily true because they are great sources of vitamin D. Vitamin B12, we have meat as well, fish, dairy, eggs. People that are vegans will need to supplement because plant foods do not provide reliable vitamin B12, unlike iron, where you can get it from plant sources. For B12, you need to take supplements if you're a vegan or vegetarian. Now, you also have omega-3 fatty acids. We have DHA, EPA. So these are to be found in fatty fish, walnuts, chia seeds, flax seeds, canola or flaxseed oil. Then you now have iodine, iodized salt, seafood, dairy are great sources for iodine. So that is how you could take supplements
Wow.
in your food.
Wow. Let me know in the comment section, please. Are you guys really getting a lot? Because for me, this is really loaded. So let me know in the comment section, how much have you packed? How much knowledge have you filled yourself with? Because she has made us to understand that fine, if you can't go to the pharmacy to get vitamin D, for instance, or if you can't go to the pharmacy to get iron, then you can squeeze your ugu. She said you can squeeze your spinach and you can enjoy your vegetable and still get those necessary vitamins. Is this not beautiful? Like this is also like to even help those people who are maybe in the rural areas who can't get access to most of those, tablets and pills. To You can even encourage them, encourage your family members to know that yes, this stuff I can get it from this place. So let us know, are you learning anything a lot? Are you learning anything at all? Are you learning? Wow, Ayomide says at this rate, my book is full. Amazing. Then we have two Ayomide here. We have Ududu Ayomide. She said, I am learning a lot. Indeed. Indeed. Because you don't need to wait, you don't need to wait for things to go south before you start doing the right thing. Most of us ladies, we prefer junk. We just want to eat on junk and eat on junk and eat on junk. But then you are not even supplementing, getting the supplements, and you are not even eating the real food. So tomorrow you are saying I am too tired. I think there is a connection between a loss of a
Vitamin
certain
B6,
vitamin.
vitamin B12, they are great for energy and also anxiety. So if you find yourself
Wow.
complaining just because you're tired is saying something. Your body is saying something
Hmm.
to you. It could be that you're lacking
Exactly.
in B vitamins. So you could take your B
Hmm.
complex. If you take B complex, it will shock you the amount of things you come down with that will just disappear. Like that, those little B complex that we have, they are the cheapest form of B complex. They in fact, no one even pays attention to them. And though that B complex, yes, even
Yeah.
that one is like the bigger one. Yeah, we have
I
the
don't
smaller
joke with
ones.
this.
Yeah, B
Hmm.
complex is a very great supplement to take. Just two in the morning, two in the afternoon, two at night is a fantastic
Wow.
medication. Yeah.
Wow.
So you can really take that seriously. In fact, if you don't want to take any supplement at all and you're just stocking up on B complex, two in the morning, two in the afternoon, two in the night, you will see the quality of your life will improve over the next few months.
Wow.
It's
Wow.
instant, really. You
Wow.
start seeing that you are no longer feeling dizzy. You are more alert. You are more strong to do things. So yeah,
Hmm.
that's my own take.
So this little bit complex can do all of like, because I know I take this, but I take it because I know fine, I know what it does for me. But now you are saying it, I think, man, it's giving me more motivation to keep on with this. Honestly, like I'm happy that this is coming to us, ladies. So and it's not very expensive. I don't think
At
it's even
all.
as expensive as
It's
you
not
see,
expensive
ladies.
at
You see,
all.
ladies.
It's
Mm,
not expensive. It's
it's
like one
not.
of the cheapest brands of vitamin B complex. And that was my first introduction to supplements when I was little. My mom used to give us that a lot. So I know that it
Mm,
works for sure.
honestly. Ladies, even for the men, yeah, you are seeing certain things that has been passing you by. You are always tired. You've not even done anything. You are complaining. You woke up from sleep and you are still complaining of tiredness. Man, like she said, get on your B complex. Please celebrate for Margaret. You all should see the things she's making us to hear this evening. B
Yeah.
complex you can get for 100 naira. You can get for, I think this one is not
Yes.
even up to
Yeah.
5,000. You can get it, and it boosts your energy. Also, she mentioned folate. So I'm actually grateful that you are here today. Ijoma said awesome. Of course, it is awesome. Now, just to dive a bit, and we are actually getting to the brim of this section. They are bringing claps and like they're telling you how excited they are. I don't know. Can you see the comments below?
Yeah. Oh, okay. Thank you.
All right. So just to let us get this last point, you've mentioned a lot. You've mentioned a lot, and I can tell you that it has really made me more motivated to keep up the good work and to see some areas. I need to start eating ugu. I need to start eating spinach. I need to start eating fish. So
You don't
yes,
like
now I
fish?
wanted to please. Ah, most times I'm actually skeptical of the kind of fish we see in the market. Some of them they tell you that it has some chemicals, this, that, and but then I need to wave off those fallacy and eat my fish with
Yeah.
confidence.
I love fish more than anything. In fact, I wish we didn't have chicken and turkey and all those stuff. I wish it was just fish. Fish is such an amazing protein to eat.
Yeah. So, Wiki, can you tell us now, for most of us women that are not taking these supplements, what are the dangers they are bound to face? Just let us know, like, the dangers that they are bound to face for not taking these essential vitamins you have mentioned. What danger?
Okay, can you hear me?
Yes, I can.
Okay, so in my own opinion, I feel like if you're not taking something you're supposed to stop something, like it's already automatic. So if you're not taking vitamin B7, you would have hair loss. If you're not taking vitamin B6, you feel weak. You feel tired after sleeping. If you're not taking vitamin D, calcium, any small thing, you have sprained your ankle, you've broken your leg, you need, so it's just the opposite of what is supposed to be doing well for you. If you're not taking any of these things in your meals, you're not taking them as supplements, then automatically you're setting yourself up for disaster, right?
Hmm.
So I didn't take vitamin C as I was supposed to, and then I had an ulceration in the inner side of my cheek, and now it's gone because I took vitamin C. So it's just you setting yourself up for things that you could avoid just because you did not do one or two the right things. So yeah, that's just it for me.
Wow. Thank you so much for Margaret. This is a true advocate, and now I see your passion. And for me, who is in the women space, who keep educating women, I am seeing more reason we need to increase our voices, because I don't want to see any lady suffer from things that they can easily change with taking their essential vitamins. You know, I don't want to see any lady, because you are not weak, ladies. You are just not taking your vitamins. You're not
Mm-hmm.
weak. You're not lazy. Your partners will think that you're lazy. You are not. You are just not taking your vitamins. And also, for those women who are actually trying to conceive, it is not like you are infertile. You are not taking the necessary vitamins you ought to take to awaken those ovaries to function properly. you know and for those who are in the menopausal phase, it is not like you are actually um getting out of your womanhood. You need to just top up your game and take the essential vitamins you need to take. Thank you so much for Margaret. This has been a very cozy ride with you. Trust me, every woman here, they are all excited. I can see them. Ayomide says, yes, health communication go. Yes, he said it needs to be breached. Of course, that is why we are here for you. And that is why I also have a community where I share this with women. I have a community on our platform. We keep talking about health. What is life without health? Of course, it's important. And also, like Margaret says, you can connect with her on her blog to learn more about vitamins. You can
Yeah, you can
connect with her
also
on her
follow me
blog.
on Instagram, Twitter, TikTok,
Yeah.
LinkedIn at Real Meggie.
Okay, so
It's
please, if you
going
want,
to
please.
yeah, it's going to help you to get information not just about your health, because the thing is, if you need money to buy supplements, you need money. That's the equation. So if you are looking for ways that you can up your game in your health and your pockets, your wealth rather, yes, you can follow me. You can subscribe to my channel. I think this is a collaboration between my channel and her channel. And I don't just talk about health, but I also show you ways that you can make money. So you can buy the
Yeah,
supplements that will help you to glow. You're welcome.
yeah,
Thank you.
yeah. All right, so that's amazing. So please, like she said, take this serious, ladies. Take this serious. I don't want to see any of you tomorrow complain about things that you can easily change. Take this serious. And thank you all for being here today. Please, for every one of us here, I hope you guys have subscribed so that you stay updated on information that will help you bridge any health issue. So for the
I made a
ID
sense.
handle,
Yeah.
yeah, for the ID handle, we'll drop them on the description. Like we'll drop the ID handle after now. We'll attach them to the description of this video. not to worry, we'll drop them. But do well to subscribe. Just hit the subscribe button right now. It doesn't take 2 minutes to do that. Hit it so that you can come back here to rewatch this video. In case you miss out on any point, you can come back to rewatch this video, and you can also share it with your friends, your siblings, and any other people you cherish. Please. Okay, so thank you so much for Margaret. It has been beautiful having you here. And for other ladies, for the gentlemen that have also joined us today, of course, there would have been no life without you guys. So thank you guys so much. We celebrate you. And we hope that on our next episode of this same live section, you will get more value. That is why we want to subscribe. Subscribe to Fan Margaret's channel as well. Okay, she'll keep you updated. Please hit the subscribe button, hit the like button, hit it. So this
Thank
has
you.
actually brought us to the end of our very first live.
Thank you so much for having me. Can you hear me? Thank you, everyone. Thank you. I think she's having network issues. Anyways, thank you so much, everyone, for joining. I'm very, very happy to have been here with you all. I'm looking forward to this next time. Bye, everybody.
Still here. Everybody left. Margaret, can you hear me? Margaret, can you hear me? I think the network is a bit. All right. So, with that said, see you guys on our next section. Bye for now. Thank you so much once again, Margaret.